If anyone sees that, that's a notice that we're in recording session now.
I've heard it, yeah.
Okay, great. So we'll move on to agenda item number 3, which is the approval of the San Francisco Health Service System fiscal year 2023 to 2024 and fiscal year 2024 to 2025 general fund administrative proposed budget. This will be presented by Iftikhar Hussain, SFHSS Chief Financial Officer. And I'll stop screen sharing for Mr. Hussain.
All right, good afternoon. I'll get, okay, that's the right one. All right, can everybody see the screen?
Yes.
Okay, great. All right, so good afternoon. I'm here to present the 2-year budget, and just for background, we prepare a 2-year budget, even though the second-year budget is subject to change. Just want to highlight that. What we're presenting to you is two views of the budget. One is budget that the mayor directed us, or that conforms to the mayor's target, and another column that shows what we need to operate to carry out our core functions. In the guidance, we had reduction targets, so we'll talk about that. And and the motion, we'll come back to the motion. So what I'm showing you here on the screen is the general fund budget first. For context, we are in the result of our work or activities are in 3 pieces. One is the Health Benefit Trust Fund, and the annual spend in that for the city and county is about $845 million. The general fund is $15 million, which is what this presentation is, and then we'll talk about the sustainability fund later. So in the budget, unlike prior years where the city had a surplus, we have a target to reduce expenses. What we are proposing is a net difference of $1.3 million in the first year, and $1.6 million in the second year, compared to those targets. And really the reasons for those are 3 main reasons. One is we feel that a quality improvement position is needed because we've had considerable variability in turnover in staff and vacancies, and we really want to use the quality improvement position to put into place, to look at our current procedures and put into place process improvements that really would help us down the road. The mayor's attrition, which is a reduction in targets, we're reversing those in our proposed budget. And then lastly, the human resources support. We think that the vacancies and the turnover, that we need HR's help to kind of fill those as they come up and actually prevent vacancies by understanding the root cause of structural issues around why people are leaving. In addition, we have an EAP request for first responder departments. The EAP funding would come from those first responder departments by reshuffling like they did last year. So it would not be a net hit to the city's general fund. Okay. So here's here's the detail of our requests: the process improvement position, the 931 position, the mayor's reduction we talked about. There are some other items which are just cleanup housekeeping items. The forfeitures from our health savings accounts, we typically limit those. Our practice has been to limit those to the administrative expenses for the HSA accounts. And we adjusted that in 24, but then for the new year, the budget we're getting from the mayor takes it back up. So we're requesting that they get adjusted back to the administrative expenses. The next thing is a possible move. Our lease is expiring at the end of November this year. So have a set aside for some moving expenses in case we end up moving. Although the details of where we would go are still fluid. Then the HR support we talked about, the EAP services we talked about, the first responder enhancements to the EAP service. The election coming up next year, we need general fund support for that. And then miscellaneous other requests, just cleanups in our budget. So the blue columns is what are the ones that the motion is a motion we're seeking for approval. And again, in this column, we show the proposal from the mayor, including the attrition, and then the adjustments of $1.3 million and $1.5 million in the second year. And then for context, we provided the 2022 actual and the current year budget. On FTEs, you could see that a reduction from the current FTE level in the proposal, and we're proposing to add that back. So in the first year, the net add of 1 FTE for the quality improvement position, and then reversing the 1.5 position attrition increase that the mayor is proposing. So that's makes up the 2.5. And the second year it goes to 3.5 because of the reversal of the attrition in the second year. So currently we have about an 8 FTE vacancy. As of January, it's about a 15% vacancy. All right, so here's the motion, and I'm happy to answer any questions on the general fund. So do we take the motion separately, or do I move on to the health service one?
These are two separate agenda items.
Okay, all right.
Madam Chair, this is Chris Canning. I don't have any questions, but would like to make a motion that we approve the proposed general fund administrative budget for the San Francisco Health Service System fiscal years 23 and 24 and fiscal year 24 and 25 as presented.
Second.
I do have, this is Commissioner Howe. I do have a couple of questions for our CFO. Mr. Hussain, if I may, Mr. Hussain, I see this is a bold move, but yet not unheard of, not to follow the instructions that were given by the mayor for the budget. So what is the thinking for a plan B if we are not granted the full amount?
Yeah, so I think so last year I think we had a budget proposal that equaled the target, and this year we're taking a different approach. If these requests are not approved, we have to look at a couple of options. One is how to operate, with a lesser budget, which would compromise our operations. The quality improvement process, I think, is really necessary dating back several years. Even when Mitch was here, that we had implemented systems and had staff turnover and not really gone through and done a full review of our processes and optimize operations. So that's been deferred for several years. And the second, the others I think are not as critical. So our approach would be two things. Number one is operate at a lower budget, or the second thing is we could look at other options such as lobbying the board of supervisors to get more funding, because we think the asks that we have are really needed.
Has that been shown to be a prudent method to that has health services, has this department been successful in negotiating more with the board than it has been with the mayor's office?
So last year, as context, we had asked for 2 positions by $500,000 request from by taking 2 positions out of the health service fund and adding that funding to the general fund, or shifting that funding to the general fund. And we were successful. But again, the new territory this year is that the city has a general deficit.
Yep. Okay, no, great. I just, I always like to know whether, there's a plan B. And so, I believe in asking for what, you need and what you want, but, obviously, we have to be prepared for a separate answer. So I appreciate that response. Thank you.
Any other comments? Okay, it's been approved, the motion's been passed and seconded to approve the San Francisco Health Service System fiscal year 2023-24 and fiscal year 2024-25 proposed general fund administration budget. All those in favor signify by saying aye.
Madam Chair, I believe we may need to open a public comment first.
Oh, sorry about that. Yeah, public comment.
Thank you, Chair. Breslin, I'll be pulling up those instructions and reading aloud. Each speaker for public comment will be allowed 3 minutes to comment in length unless the committee chair deems new public comment time limits during the meeting. All public comments are to be made concerning the agenda item that has been presented. A caller may ask questions of the policy body, but there is no obligation to answer or engage in dialogue with the caller. For those callers on the line, when I welcome you on the call, you're encouraged to state your name clearly, although you may remain anonymous. I'll give an audible warning when you have 30 seconds remaining, and when your 3 minutes have ended, I'll thank you for your call, unmute, place back on mute, and the moderator will unmute the next caller. Remote viewing is available online using WebEx. Opportunities to speak during the public comment period are available by dialing the number on the screen. The dial-in number is 415-655-0001. Again, 415-655-0001. When prompted, use access code 2483-586-5318. Then again, it's 2483-586-5318, then press pound. You'll be prompted to enter the webinar passcode 1145. Again, the webinar passcode 1145, then press pound again. You'll enter the meeting as an attendee on the public comment column.
Did we lose Holly?
I'm sorry, there's I was on mute and I'm just seeing, give me a moment here, a pause for a second. Something's coming through. Am I still coming through now?
Yes.
Okay. I'm sorry about that momentary pause. I was getting a message from WebEx. So I'll enter in again. Sorry for the delay. So each speaker will be allowed 3 minutes to comment in length unless the committee chair deems new public comment time limits during the meeting. All public comments are to be made concerning the agenda item that has been presented. A caller may ask questions of the policy body, but there's no obligation to answer or engage in dialogue with the caller. For those callers on the line, when I welcome you on the call, you're encouraged to state your name clearly, although you may remain anonymous. I'll give an audible warning when you have 30 seconds remaining, and when your 3 minutes have ended, I'll thank you for your call. You'll be placed back on mute, and the moderator will unmute the next caller. Remote viewing is available online using WebEx. Opportunities to speak during the public comment time limits are available by dialing the number on the screen. The dial-in number is 415-655-0001. Again, 415-655-0001. When prompted, use access code 2483-586-5318. Again, 2483-586-5318. Then press pound. You'll be prompted to enter the webinar code, passcode, which is 1145. Again, webinar passcode 1145, then press pound again. You'll enter the meeting as an attendee on the public comment call line and dial *3 to be added to the public comment queue. When the system message says your line has been unmuted, this is your time to speak. For those already on hold, please continue to wait until the system message says your line has been unmuted. We'll wait for our moderator to let us know if there are any callers in the public comment queue at this time.
Board Secretary, we have 0 callers on the phone line. 0 callers have specifically entered the public comment queue at this time.
Thank you, moderator. Hearing no further callers, public comment is now closed.
Okay, all those in favor of the motion that was moved and seconded, say by aye.
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 Aye. Any opposed? Okay, the motion passes unanimously. Item number 5, please.
Agenda item number 5 is the approval of the San Francisco Health Service System fiscal year 2023 to 2024 and fiscal year 2024 to 2025 Healthcare Sustainability Fund proposed budget. This will be presented by Iftikhar Hussain, SFHSF Chief Financial Officer.
And take the screen back. All right, so on the health, yes, this is the Healthcare Sustainability Fund. And for the general fund, the goal really is the context is our needs, our operations versus balancing that with the funding position and direction from the mayor. For the Health Sustainability Fund, the structure is to accumulate funds and then in this $3 PMPM fund and then use them for projects and then make sure that we are monitoring the long-term sustainability of that fund. So with that context, things we've done in the past with this fund are member communications, the e-benefits implementation, during the implementing telephony, really sophisticated systems for call monitoring and operations, and the all-payer claims database. So we've seen this slide before. The currently set at the assessment is currently set at $3 PMPM. And the annual yield that we currently getting is $2.5 million. So spending over $2.5 million uses up the beginning balances of the fund. So with the proposed budget we're going to show you, it does leave an ending balance of $2.2 million in the fund at the end through the end of fiscal year 25. And the new projects that we are implementing are really around communication and improvements in service, our website improvements, secure document exchange that can be used for DIVA and for other critical communication with our members. And the Salesforce automation, which really is a chatbot where we can answer common questions automatically without the use, redirecting the staff resources to more complex questions. And we're not proposing any FTE changes from the current year budget. So you could see here the green columns are the ones, are the budget columns that we're seeking approval for. And the changes highlighted before are the main changes. There's currently about 7.5 FTEs in the fund, and that remains unchanged. And then last year, we had 2 positions where the funding was transitioned to the general fund. That's where you see that decrease. So those are my comments on the Health Sustainability Fund. Happy to answer any questions.
Any questions, anyone?
Yes. I have a question. Can you hear me?
Yes.
Okay. This is more of a process question, Chief Financial Officer. After we have this meeting today, and we'll meet as a board on Thursday, and I presume these items will come forward at that time, what are the process steps for this review and response from both on this budget and the prior action? So can you walk me through exactly what the next steps would be?
Yeah, so the next step would be for the Health Service Board to approve the process, to approve the budget as presented now. And after that, we will then go into a discussion with the mayor's office on what they can fund on the general fund. And after the mayor's office, after we get their agreement or adjustments, it then goes to the Board of Supervisors, and they can make adjustments, although they did not last year. And after the mayor and the Board of Supervisors have made any changes, we come back to you in June, or on the June timeframe, to tell you what our adjusted budget is.
Well, I guess where I'm trying to find the difference between what the governor is going to be doing in a May revised proposal and how that gets fed into this process.
Yeah, so those would be part of the June adjustments.
The June adjustments coming from either the Board of Supervisors and or the mayor's office is what you're
Correct.
saying.
Correct.
Is that right?
Yeah, probably the mayor, not the Board of Supervisors.
Okay. I guess my question of the Finance Committee, we're not in this proposal, but in the prior one, we're asking for more. This one was seemingly asking for the same. And as Commissioner Howe has talked about Plan B, I guess the question is how we will be able to respond in this, what I call the twilight zone of this review by the mayor and the Board of Supervisors and our June meeting as a board. After we get whatever the responses are.
Yeah, I'm trying to recall. I mean, the governor's May revised. I don't know that there's a date specific on that, on when it's issued. I know the mayor's office stays in close contact with the governor's office throughout this process. But what we do know is that on June 1st, the mayor issues publicly her budget. And so that's sort of the final date that we will know if there's been any adjustments. But throughout our dialogue with them, we'll have a good sense of what they're going to approve and not approve. And then we kind of start all over again at the Board of Supervisors, where we'll be working with the budget analyst. Their job usually is to find money, not to give money. But also, it's my understanding that having asked for additional funds at the onset allows us to have a more robust discussion with the Board of Supervisors about our original ask, so that should we be fortunate enough to get some votes or some attention at the Board of Supervisors, we may be able to restore some of what was asked for by us and denied by the mayor. If we choose not to ask for additional funds now, there is no opportunity to ask the Board of Supervisors to add back, because there's no back to happen. So it's an add back process. It's complicated. It's very political, we're in hard times, and so we expect it to be a arm wrestle at best, and hope that we can get some of what we need, if not all.
All right, thank you for those clarifications. I don't know that level of detail will be discussed at the board meeting. That's why I wanted to get clarity today in this meeting about that. Thank you.
This is Commissioner Howell. Although I think a brief statement about how the controller's 9-month report that usually comes out in May and the governors may revise will, how those things may or may not impact the submission to the mayor's office, before the mayor, submits her budget to the board on June 1st. That might be helpful to us to hear.
Yeah, it's all just a matter of timing of, because we have a hard deadline for the submission of our budget to the mayor's office this month, the 20th, I
Yes.
believe, Iftikhar.
Yes.
And so that is the date of our official submission, and we will submit what is approved on Thursday. And then, as I said, the arm wrestling begins, and we'll see how far we can get with the mayor's office. And we'll keep the board informed as we can. But the official mayor's budget will be issued on June 1st. We go before the board with our budget in July. Just so you know, that's when we do it. The governor's timelines always seem a bit softer. I'm not sure what the rules are at the state level, but they even say on their public website that their budget will be issued in the summer. They don't give a hard deadline. I'm sure some of that is related to the federal discussions, of which the city is highly reliant on quite a bit of federal funds as well. So,
Any other comments? I'll entertain a motion.
Madam
Chair
Chair,
Breslin, oh,
go
go
ahead,
ahead.
go ahead, please.
Oh, Chair
Madam
Breslin,
President.
I move that we approve the San Francisco Health Service System fiscal year 23-24 and 24-25 proposed sustainability fund budget.
Second. All right. It's been moved and second. Is there any public comment?
Thank you, Chair Breslin. I'll be displaying the instructions and reading them aloud momentarily. Each public comment will be allowed three minutes in length, unless the chair committee deems new public comment time limits during the meeting. All public comments are to be made concerning the agenda item that has been presented. A caller may ask questions of the policy body, but there's no obligation to answer or engage with dialogue with the caller. I'm just wanting to check and see that you can all hear me. Am I coming in? Great, thank you. For those callers on the line, when I welcome you on the call, you're encouraged to state your name clearly, although you may remain anonymous. I'll give an audible warning when you have 30 seconds remaining, and when your 3 minutes have ended, I'll thank you for your call. You'll be placed back on mute, and the moderator unmute the next caller. Remote viewing is available online using WebEx, and opportunities to speak during the public comment period are available by dialing the number on the screen. The dial-in number is 415-655-0001. Again, 415-655-0001. When prompted, use access code 2483-586-5318. Again, 2483-586-5318. Then press pound. You'll be prompted to enter the webinar password 1145. Again, webinar password 1145. Then press pound again. You'll enter the meeting as an attendee on the public comment call line and dial *3 to be added to the public comment queue. When the system message says your line has been unmuted, this is your time to speak. For those already on hold, please continue to wait until the system indicates you have been unmuted. We'll wait for our moderator to notify us of any callers in the public comment queue at this time.
Secretary, we have 0 callers on the phone line. 0 callers have specifically entered the public comment queue at this time.
Thank you, moderator. Hearing no further callers, public comment is now closed. And Chair Breslin, whenever you're ready, we can take a roll call vote.
Okay, all those in favor of the motion signify by saying aye.
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 All right, it's unanimous. The motion passes. So item number 6 is adjournment.
Well done,
Oh.
Karen.
Yeah, aye.
I just want to thank the Health Service Board members for their support on this not usual ask. So thank you very much. The
No,
staff
thank you.
appreciates it, I'm sure.
Thanks for your work.
You're welcome.
Yes, thank you.
Mhm.
See everyone
Thank you,
Thursday.
Star and Abby, as well as the rest of the commissioners, and we'll see where this goes after Thursday.
Can't wait.
Nothing but fun.
Bye,
Okay.
everyone.
Bye-bye.
Bye-bye.
Bye.
Bye. Thank you. Adjournment at 12:40 PM.
I'll do better, Abby, in terms of getting into the governor's